from Group
1A1.
Hi, I'm Farah Hendra. I'm in charge in the introduction, pharmacological management, and also the video making.
Hi, I'm Faye and I'm responsible for the nursing care plan.
Hi, I'm Aziz. I will be presenting disease process, medical management, and also surgical management.
Hi, I'm Manera Binti Azaman. I'm the one doing the case presentation, which consists of biographical data, chief complaint, presenting symptoms, past health history, assessment, and review and summarize the result of clinical examination.
Have been attached to male radiotherapy unit in SGH for a week from 29 October to 2 November 2018. We have decided to choose a patient from the ward to be the subject for our case study. 56 years old gentleman presenting with metastatic adenocarcinoma of the spine, lung primary, were reviewed by a doctor from emergency department in yellow zone when he claimed that he was experiencing bilateral lower limbs weaknesses and pain at the lower back for over 3 days. He was then admitted to MRTU for further management. His case has got our attention because that was the first time we encountered a case regarding lung cancer metastasis to bone. We have been attached to radiotherapy unit for several times and we do encounter patients with lung cancer but not with metastasis. After we have done a few findings, we found out that the bone metastases are common in patients with lung cancer. It has been reported that around 30% to 40% of patients with advanced lung cancer have been affected with such condition, that is according to Eldridge in 2018. A study regarding bone metastasis in patients with lung cancer has been done recently to identify the risk factors. A total of 2,021 patients who were diagnosed with lung cancer between January 2005 and November 2016 were included in this study. From this research, a total of 483 patients, which is around 23.9%, were found to be affected with bone metastasis, according to Zhu et al. In 2017. As mentioned by Zhu et al. In 2017, adenocarcinoma, which is around 62.1%, was the most common pathological subtype, and rape, 62.3%, was the most frequent distant metastatic site, followed by thoracic, 53.8%, and lumbar spine, 40.4%. Zhu et al. In 2017 again explained that the risk for lung cancer patients to develop multiple bone metastases are high. This study found that 41.8% of the patients only affected at one site and 38.5% of the patients developed more than 3 metastatic sites. In this patient's case, his lung cancer cells has metastasis to cervical, thoracic, lumbar, and sacral spine, including left iliac bone, right, third, and 10th ribs, and caused him to experience great pain, spinal cord compression, loss of functional independence, and reduction in quality of life, which are common symptoms of bone metastasis. Now, let's move on to the patient's biographical data. We have to keep this patient's personal data confidential, so we decided to name these patients as Mr. X, a 56 years old gentleman, Malay. Mr. X is a pensioner. He previously working as a supervisor at a private company, while his wife is a full-time housewife. He is living with his family in Kuching, Sarawak. On the other hand, he is a non-smoker and a non-alcoholic person. He also has no known allergy to red foods, drug, or dye. Mr. X is a married man with 2 children, 1 boy and 1 girl. His oldest daughter is 16 years old and his youngest son is 14 years old. And lastly, Mr. X denied any family history of diabetes mellitus, hypertension, heart problem, or even malignancy in his family.
Chief complaint. The patient was brought to Emergency and Trauma Department, Sarawak General Hospital HGH on 15 October 2018 by his wife and children due to complaint of weakness of bilateral lower limbs for 3 days, pain at lower back with pain score of 8/10, and unable to ambulate since past 2 weeks. He was taking Tab Arcosia 120 mg given by Norma Medical Center as a relieving factor, but claimed it did not help much to reduce the pain. While the aggravating factor, he claimed the pain getting worse during active movement. For responses to other treatment, the patient defaulted the appointment given by medical officer at Norma Medical Center to be referred to radiotherapy unit HGH for further treatment. Presenting symptoms, he has been experiencing the radicular pain and weakness over his both lower limbs for a period of 3 months. It has started 3 weeks after he underwent a surgical procedure at Norma Medical Center in June 2018. This affected his mobility and caused him unable to ambulate himself and require use of wheelchair. He also needs assistance from his family to do ADL such as bathing, grooming, toileting, ambulating, and transferring. The patient verbalized the pain getting worse for 3 days before he decided to come to the hospital due to unbearable pain. He was given a painkiller Tab Arcosia 120 mg from Norma Medical Center. Currently in the ward, the painkiller has been changed to subcutaneous morphine 7.5 mg every 4 hourly and break through the pain. Moreover, he also came to the hospital associated with constitutional symptoms, radiculopathy, and poor oral intake. Past health history. Previously, the patient was came and seek treatment at Norma Medical Center due to complaint of back pain. He has undergone a posterior decompression at L4 together with vertebroplasty and spine biopsy and stabilization of spine from L2 to S1 on 18 June 2018. During post-operative period, he was able to ambulate himself and stated increase in power at both of his upper and lower limbs. He also has history of hypokalemia, and based on daily blood urea serum electrolyte BUSE tests done in the ward showing that his potassium level is now within the normal range.
In the disease process, I will explain the pathophysiology of the disease and how it is related to his signs and symptoms. Now we go on to the disease process. So what is adenocarcinoma? Adenocarcinoma is a type of cancer that starts in the mucous glands inside the organs like lungs, colon, or even breast, according to Martin 2017. Adenocarcinoma of the lungs is a subtype of non-small cell lung cancer. It tends to develop in smaller airways, such as bronchioles, and is usually located more along the outer edges of the lungs. Eventually, the cancerous cells spread or metastasize to other parts of the body, including the local lymph nodes in the chest and the central portion of the chest, liver, bones, and spine, through the blood and lymph vessels. When the lung cancer metastasizes, the tumor in the lung is called primary tumor, and the tumor in other parts of the body are called secondary tumor or metastatic tumor, according to Dewi 2014. Tumors within the bone of the spine can make the bone weak enough to eventually fracture. A fracture can be extremely painful and can seriously affect the patient's quality of life if the fracture has affected the spinal cord and nerve surrounding. Growth of lesion at the spinal cord can compress nerve endings in and around the spine, causing pain and weakness of the arms or legs. In extreme cases, paralysis may occur. The growth of lesion also initiates the narrowing of spinal cord, which causes spinal cord injury to happen. This is called spinal canal stenosis, where the stenosis area puts pressure on the spinal cord and spinal nerve roots, which induces the pain sensation. Due to decompression fractures and central spinal stenosis, patients show signs and symptoms of hip pain due to the spinal canal stenosis, which pushes the nerve roots and causes pain. Sciatica, which the pain results from the sciatic nerve due to the compression fracture at L5, presses the sciatic nerve. Weakness and numbness of lower limbs due to the nerve being compressed at lumbar region, causing lower extremities deficit.
Now, we will be explaining about the management that this patient has undergone in terms of the medical, surgical, and pharmacological.
For surgical management, there are two surgeries has been done to this patient. For the first one is posterior decompression. A decompression involves removing the spinous process and lamina of the spine, or laminectomy, to give spinal cord more room. Then, a spinal fusion of L2 to S1 also be performed to stabilize it by inserting screws and rods to hold the spine steadily. Fusing the joint prevents the spinal stenosis from recurring and can help eliminate pain from an unstable spine. The next surgery is vertebroplasty. In this surgery, the bone cement is injected into the backbones at the lumbar region that have cracked or broken because of metastatic cancer. The cement hardens, stabilizing the fractures and supporting the spine. The purposes of this procedure are to stabilize the spinal fracture and stop the pain that is caused by the fracture. For the medical management, the patient undergo radiotherapy to control the growth of the cancer. According to McGill 2018, radiation therapy involves delivering powerful wave of energy to disrupt the ability of cancer cells to grow and divide, killing cancer cells, slowing their growth, and shrinking tumors to enable surgery. But for this case, the purpose of radiotherapy is for palliative treatment, which are to reduce the symptoms and control the growth of metastasized cancer cells. Patient has undergone 5 cycles of radiotherapy at vertebrae of L2 to S2. Other medical management such as the usage of TED stocking to reduce the risk of getting venous-related diseases and diabetic diet for blood sugar level control. The outcomes from those managements are
These are the list of the medications that have been prescribed to the patient. Tablet amlodipine 10 mg OD. Tablet metformin 500 mg OD. Aqueous morphine sulfate 5 mg every 4 hourly. Capsule tramadol 50 mg TDS. IV dexamethasone 8 mg TDS. Bisacodyl 2 tablets BD. Syrup lactulose 15 ml TDS. Pantoprazole 40 mg OD.
So I'm going to present about our nursing care plan. We have identified 5 nursing care plan for this patient. First is acute pain, imbalanced nutrition, less than body requirement, activity intolerance, risk for fall, and risk for deep vein thrombosis.
First NCP is acute pain related to metastatic adenocarcinoma to spine,
Lung primary, as evidenced by patient's complaint of back pain, and the pain score is 8/10. The goal for this NCP is patient will be able to verbalize decreasing of back pain and pain score decreases to 0 to 2/10 within 4 hours of receiving analgesic medication. There are 6 nursing interventions for this nursing diagnosis. Firstly, assess vital signs which are blood pressure, heart rate, respiratory rate, temperature, and especially pain score as a baseline data to compare the progression of patient's condition. Second, monitor pain score 4 hourly for comparison of patient's progression. Third, position patient into supine with head slightly higher to reduce the pain and to increase comfort of patient. Fourth, assess patient current medication, especially the dosage, to identify if the medication is enough to reduce the pain. Fifth, educate patient non-pharmacological technique such as deep breathing exercise to help in reducing the pain. Lastly, serve medication as prescribed by doctor, which is painkiller medication such as morphine 5 mg 4 hourly to reduce the pain. The evaluation is patient verbalize back pain decrease and the pain score decreases to 1 to 2/10 within 4 hours of receiving analgesic medication. The second nursing diagnosis is imbalanced nutrition, less than body requirement related to radiotherapy, as evidenced by decrease in body weight and poor oral intake. The goal for this NCP is patient will be able to increase body weight and oral intake. The nursing intervention for this NCP is 1. Assess and monitor patient's weight for comparison of progression. Second, ensure patient have good oral hygiene to increase appetite of patient. Third, provide food in appetizing appearance to ensure patient is attracted to eat. Fourth, ensure patient surrounding during meal is odor-free and clean to increase patient's appetite. Fifth, encourage family members to accompany patient during meal time because companionship may increase appetite of a person. Lastly, encourage family members to bring food from home as homemade meals are more appetizing than hospital meal. The evaluation for this NCP is patient able to increase oral intake within hospitalization. The third nursing diagnosis is activity intolerance related to body weaknesses as evidenced by decreased strength at lower extremities. The fourth nursing diagnosis is risk for fall related to body weaknesses as evidenced by decreased strength at both lower limbs.
The last nursing diagnosis is risk for deep vein thrombosis related to lack of active movement as evidenced by patient is completely bedbound due to weakness at both legs.
That's all from us. Thank you for watching.
Bye.